welcome our doctor. Okay, doctor, are you ready? So let me maybe play the video first, okay? Okay.
So,
doctor,
good
are you
evening,
ready?
everybody. Hope everyone is doing well.
Okay.
During these trying times.
Hey, doctor, how come? Can you hear, doctor?
Can you hear me? All good?
Yes, can hear. We can hear.
Okay. So now we've already gone into
I cannot hear.
October in this year, and things have progressed pretty fast this year for some of
maybe
us.
Problem from my side. Wait, hang on. Then I need to off my.
It will just
Okay, can you hear me right now?
Yep, can hear.
Okay. Just now maybe my Bluetooth problem. Okay, doctor, shall I play the video first?
Yeah, so I'm going to go into before we start off the presentation. I know everybody's waiting to hear about how COVID and photobiomodulation works, and we're going to have an interesting talk today. Vantros, which is CV8. It's a fairly new product, which is actually essentially stem cells, ginseng stem cells from Korea. So I'm just going to talk a little bit about a clinical trial. We had a mini clinical trial with a few patients where we gave them CV8, 2 doses twice a day, morning and night, and they took it for a period of 2 months. And we did blood tests for them before they started the CV8 and after 2 months, just to do a comparison to see how they progress with the CV8. So I'm just going to share with you that, and so we can just take a look about how the CV8 works. So can everybody see the screen? Is it all good, Jaslyn?
Yes, we can see it. Yeah.
Okay, so starting with the first patient, right? The first patient essentially had issues. Very commonly, we see in Malaysia, we see patients with hypertension, diabetes, high cholesterol, and fatty liver. So we thought we'll target the trial mainly on patients who have high cholesterol and fatty liver issues. About 30 to 40% of Malaysians have fatty liver issues, normally related to diet and cholesterol as well, essentially triglycerides, which is the bad cholesterol, and the LDLs. The HDLs are the good cholesterol. So as you can see here, this was the previous result, the initial result before they started taking the CV8. Their triglycerides were elevated. Normal is about 1.7, and theirs was 3.6, quite highly elevated. The patient was not given any cholesterol medications, but were put on the CV8 for a period of 2 months. And after 2 months, the repeat showed a reduction in the triglycerides by 2. Also, the good news is the HDL from 1.2 increased up to 1.4. So that's the good cholesterol, which can also increase when a person has generally a good mood and they sleep quite well, they exercise, they have a clean diet. The HDL goes up, and also genetics have a component in that. So this CV8 also helps to boost up, not only reducing the bad cholesterol, it helps to increase the good cholesterol. And the LDLs were maintained more or less around the same. Essentially, between the two, the triglycerides are the ones that are more dangerous, and they clot around the arteries and cause blockages. So essentially, we want to reduce the triglycerides. Then the second is the fatty liver. There are 3 essential enzymes in the liver, the AST, ALT, and GGT. So this was grossly elevated, and in a period of 2 months, it's quite remarkable. There's a drop by about 20 for the GGT, and the AST also dropped, and the ALTs also dropped. So as we can see, the cholesterol improved and the fatty liver improved. Moving on to the second patient also has fatty liver, but with diabetes instead. And diabetes is measured, one of the markers to measure diabetes is the HbA1c. HbA1c is a 3 months evaluation of a person's sugar control based on their diet. And so it gives an average value. So normally we try to keep it under 6.5. So this was 6.7. And from a diabetic state, the person went into a pre-diabetic state. So actually managed to reverse the diabetes, which is pretty impressive. There was no diabetic medicines given to the patient as it was early stage, but patient also did lifestyle changes, which encompasses some dietary changes as well as exercise. And the fatty liver, you can see the liver enzymes were quite markedly raised here. You can see a significant drop, almost by about 50 for the GGT, and the AST and ALTs also dropped significantly. So the patient, from having fatty liver, reversed the fatty liver back to normal. Third patient has high cholesterol and fatty liver. You can see the high cholesterol has been reversed from elevated levels to normal levels, and the HDL also has improved. Normally HDL should be more than 1. From 0.9 it went up to 1.4, and you can see the fatty liver changes, which was very significant. 102, 66 and 59 dropped down to 52, 49 and 47. So good improvement there. And second last patient had high cholesterol and diabetes, and you can see that the triglycerides dropped from 1.8 to 1. The HDL improved from 1.3 to 1.6, and the diabetes from 6.7 actually reversed to a pre-diabetic state of 5.9. So very good results there. And the last patient has high cholesterol and fatty liver, and the high cholesterol, as you can see, the high cholesterol is 2.2 and it reversed to 1.8, and the fatty liver from 68 to 49, 57 to 39, and 50 to 36 managed to reverse the fatty liver. So CV8 shows pretty good results in terms of the ginsenosides. Basically CV8, it contains this CMC, meristematic cambium stem cells, and this is what is referred to as replicating in an undifferentiated state. So it can keep on replicating and replicating in a young kind of a state. So it always maintains the same, despite them having to multiply the stem cells. There's no change from the original stem cell, so it remains undifferentiated. So this is a technology only that Plantel in Korea has this technology, and so far nowhere else, and they've even got some patents behind that technology. So pretty effective and interesting technology that they have. So we can see here the improvements with the CV8. It comes in a sachet form, and they took 2 sachets a day over a period of 2 months. Okay, so moving on, we're going to be going through a little slide which is going to explain about how Malaysia is faring in terms of cases per capita, in terms of per million. And you can see a slide, an interesting slide, which I'm just going to play. Jaslyn, do you have the slide?
Okay, can. Let me play for you.
Okay, so we can see here, this shows that in March last year, the number of cases, for those of you who can't see, South Korea and China were one of the highest cases in this region. This is number of cases of COVID deaths per million. And we can see somewhere in around June of last year, India, Indonesia were having some of the highest cases per million. That means based on population. So you can see that the cases for India were quite high last year around this time. And then slowly Indonesia's cases are increasing, followed by Myanmar. And Malaysia is still at the bottom somewhere, not that high, not so significant in terms of the number of cases. And as the date goes up, now it's February of this year, Indonesia is higher than India, followed by Myanmar, Malaysia, and South Korea. So Malaysia is still lower than those bigger countries. And then moving on to June, you can start to see an increase in the number of cases as Malaysia slowly starts to increase from 100 to 150 to 200, 250, 300, and then it bypasses India, and then it overtakes Indonesia as well, and then keeps on going up by September this year. So the timeline ends on September 21st this year. And yeah, so that shows the severity of what's happening right now in terms of the number of cases. So moving on, I'm going to go into a presentation which is going to talk about COVID and photobiomodulation and how they work synergistically, how photobiomodulation works to clear off COVID in the body, both on a preventive scale as well as on a therapeutic scale. Okay, so talking a little bit about what COVID is. COVID is an RNA virus from the family called Coronaviridae family. So RNA stands for ribonucleic acid virus, and the symptoms can last somewhere between 1 to 2 to sometimes even 3 weeks. And 80% of the cases are mild cases. About 10% are severe, and 5% critical, and around 2% of death. Now this varies. This may not be across the board. It can be more, it can be less, depending on the variant, depending on the person's starting point of health, and also how severe the disease is when it affects the person and their response from their immune system. So initially the virus will start to replicate. It starts to multiply at the nose, the nasal mucosa, and the pharynx, so nose and the throat initially. And then as it starts to progress, it will go down to the respiratory tract towards the lungs and even the gastrointestinal system, so the GI mucosa, that means in the stomach. So coronavirus has spike proteins. And these spike proteins, I'll show you a picture in a short while. They are these sharp spikes, and that's how it got the name. Corona essentially means crown. So with all these spikes, it attaches to these ACE receptors, or angiotensin converting enzyme receptors. Some of you may have heard of the word ACE blocker, or angiotensin converting enzyme blocker. They are actually used as a blood pressure drug because we have ACE receptors in many different organs in our body, essentially the lungs, blood vessels, the heart, the liver, the kidneys, and even our gastrointestinal tract. Even in the stomach, there's ACE receptors. So these spike proteins on the coronavirus have an affinity towards the ACE receptors in the person's body, in the host's body, or the person who's getting the COVID. They go and attach like a lock and a key kind of a mechanism. So it's like a car going into a car park. The ACE receptor locks into the coronavirus spike proteins, and then they link up together, and that's how it stays and attaches and starts to multiply. So this is a picture of how microscopically the coronavirus looks like. And as you can see, the purple areas are the COVID in itself, and the spike proteins are the red, orangey projections sticking out. And the ACE receptors are the blue on the host's organs. So the ACE receptors are found in the lungs, in the heart, blood vessels, liver, kidneys, and in the gastrointestinal tract. So they can also cause digestive issues. So initially, like in China, when a lot of people were diagnosed with COVID, they thought that they were manifesting lung symptoms, like a cough and respiratory symptoms, running nose, sore throat, fever. But there was a group of patients who were put in the general ward who were having diarrhea, nausea, and vomiting. And they were attributed to having food poisoning or gastroenteritis or infection of the stomach. And later it was found out that they were actually also COVID positive, and they were transferred to a COVID isolation ward. So the reason being is that COVID not necessarily will present with only respiratory symptoms. It can also present with digestive symptoms like nausea, vomiting, and diarrhea. So talking about the complications of COVID, I'll just briefly touch about the complications of COVID. One of the main things that we're concerned about is when it causes acute respiratory distress syndrome. So that's when the person's respiratory function starts to get impeded and affected, and there's insufficient oxygen from going from the lungs into the bloodstream. And there's a upsurge of these inflammatory cells in the body, which are known as the cytokines. Cytokines are also immune cells. They have a positive benefit in our body, but when large amounts of cytokines are produced, they start producing an inflammatory response. So it's something like the COVID virus dies in our system and they start producing a lot of dust or debris. And this dust or debris starts to cause a lot of lung inflammation and production of a lot of fluid in the lungs or water in the lungs. And that can lead to respiratory failure. That's usually in a hospital setting, the person will go into an ICU, they will need ventilation or intubation, where they put a tube into the person's throat and then they put them on an artificial respiratory machine and they give them ventilation. So coming to photobiomodulation and how this correlates, the initial explanation will be on the technology of photobiomodulation. And here we talk about how using light is essentially a polarized, non-ionized form of light. So it's completely safe and not harmful to cause any side effects or any adverse effects to the person using it. It's using a near-infrared spectrum of light. So this is a very therapeutic spectrum, a very specific spectrum. In the case of IM laser, it will be 650 nanometers, which is the most therapeutic range. And it uses this to stimulate and heal and reduce inflammation. And also it has intracellular reactions that improve the cell activity. So the cell starts to function at a more optimum level. For example, the cell is the most basic building block of the body. So the cell, multiple cells, for example, we have multiple cells like beta cells in the pancreas. So multiple cells will form a tissue, and multiple tissues will form an organ, like for example, a pancreas or a liver, and multiple organs form a system. So example, the pharynx, larynx, trachea, bronchus, lungs, they form the respiratory system. And multiple systems will form the whole body. So the most essential building block of all this comes back down to the cell. And when something targets the cell, this is called cellular regeneration or regenerative medicine. So this is the field that photobiomodulation falls into. It's actually regenerative medicine. It's targeting the cell, cellular medicine, and it helps to regenerate the tissue cells into a healing process. So the cell, picture the cell as a box, and things have to go in and out of the box. So there has to be a door and like a membrane. So the membrane, the permeability or the allowance of things to travel in and out is actually adjusted with using this PBM or photobiomodulation therapy technology. It also helps to increase the nutrition that passes from in and out of the cell. It increases the oxygenation of the cell. So the cell carries more oxygen, and oxygen is very vital for organs and blood vessels to function. It works on the mitochondria, which we'll be talking about in a bit. And it works on the nitric oxide pathway. So photobiomodulation works on something known as the electron transport chain. In short words, there's a powerhouse inside all our cells. And the powerhouse in our cells is referred to as the mitochondria, where tons of energy is produced from birth. We have mitochondria in all our cells. So the mitochondria is where the photobiomodulation works towards. In the fourth complex known as the cytochrome C, it absorbs the light of the photobiomodulation and starts to increase the production of ATP. So in this electron transport chain, we learn in the biochemistry subject in medicine, from 1 ATP, we produce up to 8 ATPs. So 8 times the production of ATP, which is a very, very good method through this system in the mitochondria to produce high amounts of ATP. And ATP is required by all our cells to function at an optimum level. So this is essentially how a cell looks like, and the nucleus is in the center, and the mitochondria is where all the genetic material lies in as well, apart from the nucleus, and also where the energy powerhouse and ATP production is derived from. So even doctors, the head of Malaysia anti-aging doctors also said that if you work on anything that works on improving the function of the mitochondria, you're heading in the right direction. So higher ATP results in more energy efficient cell. The cell is functioning at a better efficiency. Like a younger person will have more ATP than an elder person. Oxidative stress is the damage, and the oxidative stress gets pushed into the bloodstream, and the cell is vibrating at a healthier frequency. So it pushes out the oxidative stress from the cell into the bloodstream and makes the cell function at a particular frequency, which is a healthy frequency. So we are all essentially actually energy bodies, and we function at different vibrations. They've done research where a cancer patient's cells vibrate at a different frequency. A healthy person's cells vibrate at a different frequency. So these frequencies that the cell vibrates is very essential for maintaining health. And energy, there's even something called energy medicine, because it's such a large field that it's a one branch of medicine on its own. So in reference to Chinese medicine, they refer to energy as the qi, or our vital source. And for in Ayurveda, they refer to it as the chakras. And in Western medicine, they refer to it as the milieu interior. So this is all referring to energy, of which we optimally try to function at a particular frequency. So the immune systems function more optimally, inflammation reduces, and the cells become healthier, and the body also becomes healthier. So clinical studies have shown that photobiomodulation has positive effects on the immune system. We have two types of immune systems. We have an adaptive immune system and an innate immune system. So this will be referring more to the adaptive immune system, and this will help to reduce the effects of severe COVID, as well as what I mentioned earlier in terms of the acute respiratory distress syndrome. And also photobiomodulation can help to reduce the severe inflammatory response produced, which we were talking about just now, the cytokine storm, and can also help to reduce development of ARDS. So there's also reduction in conditions like chronic obstructive pulmonary disease, and may be able to help reduce something called pulmonary fibrosis or lung scarring, where the lung tissue hardens and there's scarring of the tissue, which sometimes after a person recovers from COVID, they can have something called long COVID, which can be symptoms that last anywhere between 3 to 6 months. And they have symptoms of fatigue, tiredness, headaches, skin changes, sleep changes, difference in their energy, and also in their breathing. So sometimes the breathing can be caused by some fairly permanent or near temporary damage to the lungs, which is called pulmonary fibrosis, which sometimes will require a person to see a chiropractor and go for lung rehabilitation exercises. It also helps to increase the cellular regeneration in the lungs, increase the oxygenation of damaged tissues, and some studies have shown that photobiomodulation can reduce the risk of long COVID symptoms. So there's a clinical study where they took a group of patients and they divided them into two, those that were receiving the photobiomodulation treatment and those that were in the control group. The control group, 60% of them required to go into ICU, and there was a mortality or death rate of 40%, and 40% in the control group who did not receive the photobiomodulation had long COVID, symptoms that I mentioned just now of the tiredness, the changes in the breath, the changes in the energy levels, sleep changes. They had long COVID symptoms even after 5 months, 40%. As for the group that had taken the photobiomodulation, there was no ICU admission. There was no ventilation. None of the patients required ventilatory support, and none of them had symptoms of long COVID. was a pretty interesting study. They had used photobiomodulation for half an hour a day. So photobiomodulation reduces pulmonary edema, neutrophil influx, and cytokines like TNF alpha, interleukins. So basically what this means is it reduces the water in the lungs, it reduces the number of white blood cells and inflammatory cells, and these inflammatory cells are directly linked. In fact, this word here, interleukins. Interleukins are one of the inflammatory cells or immune cells in our body. It's a very important cell in a right proportion, but in large proportions, they can cause havoc to the body. They can cause a lot of damage to the lung. So in COVID, they have noted that patients who have high amounts of interleukin 6, interleukin 8 production, they have most severe forms of COVID. It's basically something similar to a bank robbery where they're the robbers in the front and then the police are attacking them, and the collateral damage to the walls and the damage to the buildings around are similar to what is the damage to the lungs. So there's excessive damage to the lungs because of excessive production of these inflammatory cells. So photobiomodulation helps to reduce this lung inflammation and promote regeneration of the damaged lung tissues. It also helps to increase oxygen and help to rehabilitate the affected organ. It also helps to enhance mitochondrial function and immune function through the production of interleukins and the nitric oxide pathway. So it helps to reduce the pro-inflammatory cytokines and reduce overaccumulation of the neutrophils, which reduce lung inflammation. So basically it works on the inflammatory pathways and the immune pathways, and as well as nitric oxide pathways, to reduce the damage to the lungs and the inflammation in the body. In conclusion, photobiomodulation can improve immune function, reduce the cytokine storm, may help to reduce poor prognosis in ARDS or acute respiratory distress syndrome, reduce risk of secondary infection, and may help to reduce the period of hospitalization. So for example, if a person were to stay in the hospital for a period of 10 days, it may be able to help to reduce that to say maybe 6 or 7 days. So in the US, photobiomodulation is a certified FDA-approved treatment for pain and inflammation since 2011. The technology was first recognized approximately about 100 years ago, more so around 50 years ago, but has got a lot of focus over the past 10 to 15 years. So IM Laser is a certified medical device in Malaysia, the only medical device, photobiomodulation medical device that is certified. In order to get this certification, it had to go through stringent testing and 4 stages of testing, which took on average around 4 years to complete. They had to test almost every part of it, and to get the certification was a long process, but they managed to get it certified as a medical device. So it is completely safe and free of any adverse effects. So this is the certification that it's received. And just a touch on essentially treatment for COVID will be a holistic approach. So it's important for us to keep ourselves healthy during these times. A lot of us have mental health issues with the strict SOPs and the inability to move around, and some of us are working from home. In fact, a large number of my patients are now shifted to working from home. I think companies have realized that they can do a lot of cost cutting and save a lot of money, and at the same time, people can stay at home. But when you stay at home and you don't go to work, that sense of fulfillment that you're actually going to a workplace and you're coming back from a workplace, sometimes the home environment may not be the most congenial environment for work, because there may be a bed nearby and there may be not proper ergonomics for working. So it's important for us to stay healthy and keep fit, and supplements can help, some of which could be garlic. Person can consume garlic capsules, or even zinc. Zinc has some benefits to block the receptors of which COVID attaches to the body. And steam inhalation has proved to be quite beneficial for about 5 minutes a day. Now you can get these devices from Shopee or Lazada where there are these steam inhalers, and you just have to add hot water, or just have to add filtered water, and it will convert it to boiling water, and lots of steam will come out, and it's very convenient. So steam actually kills off the cells of the coronavirus, and regular exercise, even walking or Zumba or any form of exercise for that matter, and eating healthy, lots of fruits, vegetables, and legumes, lentils, and sleeping on average between about 6 to 8 hours is what is essential. It's ideal, but maybe a lot of people who are working long shifts, or they have to double up work at night, sometimes they can't achieve the 6 to 8 hours of sleep. But interestingly enough, some of the protocols that are used to treat COVID use a supplement called melatonin. And melatonin is actually our own sleep hormone that we produce by ourselves. So sleep is very essential. Like if we don't get enough sleep, I've seen people who work night shifts and then they don't get enough sleep during the day, and then they end up having high blood pressure and other issues, and fatigue. So sleeping between 6 to 8 hours is what is considered ideal. So these are all the factors: exercise, good food, good sleep, and supplements. This is steam inhalation. This is the traditional way of doing it. So this also can be quite beneficial to help combat the virus. Thank you very much.
Okay, thank you, doctor, for your great sharing. And I believe that maybe there's a little bit technical, so I believe that you all have a better understanding what is actually photobiomodulations. Okay, so anybody don't come across or never heard about photobiomodulation before? In fact, another name for photobiomodulation is actually called cold laser. It's actually the light that we are using right now, or LLT, low level light therapy. It's the same light, just like the technical name. Okay, the science name that given to this light is called photobiomodulations. Okay, so any question from the floor? It's actually Q&A session right now. It's actually open to the floor. Any question? No question. Any question right now?
I hope the presentation wasn't too mind-boggling that people don't. It's good.
Can you understand or not? Actually, so it's quite simple, straightforward.
You can,
Most important is
if you have
actually,
any questions on photobiomodulation or on COVID itself, if you have any questions or anything that you wanted to ask on a medical side regarding COVID.
okay. I mute all first. I mute all first. Okay, just now I saw Johnny. Johnny. Okay, I mute Johnny. Hi, Johnny. Okay. Is it my line problem or Johnny? Can you? Oh, okay. I unmute you already. Wait. Let me unmute you. Gee, okay. One by one, yeah. Johnny first. Hey, how come? Wait. How come cannot unmute you? Unmute. Okay, I unmute all. Okay. Can you, maybe Johnny, can you talk first?
Still cannot be unmute.
Eh? How come? I already unmute all already.
Yeah, Johnny is still mute.
Still mute. Wait, let me see.
Yes.
But I saw majority. Okay, just now I mute him already. Let me mute and unmute again. Wait. To unmute. How come cannot unmute? Okay, I unmute all again. Okay, ready. But the line is a bit lag. Yeah. Johnny, I can't hear you. Can you hear Johnny? Because the line is actually
Yeah,
I'm
it's
not sure. Yeah, can you hear,
breaking up.
doctor? Breaking up,
Breaking up.
Johnny, we
Breaking up,
can't
yeah.
hear you.
Maybe you can type.
Yeah, the line is no. Oh, the line. We can't really hear.
Johnny, your line is not good. Maybe Johnny, you can write on the chat and ask.
Yeah. Maybe you can write.
Okay. Yeah.
Maybe you need to write in a checkbox because we can't
Johnny,
really.
your line is keep breaking. So I think you better write on the chat so that we can answer your questions.
Okay, shall we go to next question first? Okay, Johnny, we really can't hear you. So sorry. Maybe you
Okay,
write.
can I ask? Can I ask?
Okay, Ramesh, wait. Okay.
Can I ask the question?
Yeah, sure.
Can I ask? Can you hear me?
Yeah, you are Ramesh, is it? Ramachandra.
Ramachandran. Yes.
Okay, Ramachandra.
Regarding
Yes.
the CV8, I
Mhm.
saw you did the HbA1c. Whether any test done on the OGTT?
No, we nowadays all the new guidelines we use HbA1c. OGTT is good, but OGTT was formerly used, and now HbA1c is more commonly used.
I'm asking this because why, as in insurance, yeah, we this insurance, as I'm an insurance agent, and I found that OGTT is what the insurance company asked for. So
Okay.
it'll be very helpful, if the OGTT is done and you can really improve. Many of them will be really interested in the product, CV8 and all that. Yeah, that's why I'm yeah.
They can also use HbA1c as a guideline.
No, correct.
The HbA1c gives an average value of the 3
Correct.
months control of the sugar levels.
But the insurance companies are more, they if you look at, if you can get the OGTT test, the insurance companies are willing to even offer medical cards and all that. So I think that will really help a lot of people will be interested in buying the product. That's what I'm trying to say. Yeah.
Right.
So I'll just propose.
Thank you. We'll take note of that.
Please. Yes. Thank you. Yeah.
Okay. Thank you, Rama. Okay.
Welcome.
Okay, Rama. Next question. Wait, let me see. I think there's a question in the chat room. Hi, doctor, from Kenneth. Kenneth, hi, doctor. I have a friend has got inherited G6PD. Can IM Laser help in this G6PD?
Yes, IM Laser can help because G6PD patients, sometimes they have a little bit of tiredness issues. So if the patients have any issues with tiredness, it can help to improve their mitochondrial function, and then they can work more optimally to get better energy. So for those who are not familiar with the application, there will be a wrist application as well as a nasal line. And in this instance, the nasal line will be necessary to use, and along with at least about twice a day on average.
Okay, enough? Did doctor answer your question? I believe yes, right? Okay, so next question. Just now I saw Vicky, is it? Someone raising up. Yeah,
yes.
Vicky, okay.
Can I
Yeah, sure.
Hi, Dr. Ashvin. Dr. Ashvin.
Vicky.
Hello.
Hello,
Can
hi.
you hear?
Yeah.
Hi. Okay, Dr. Ashwin, I have been using it for a while, this IM Laser, and I was using on my son. I have a Down syndrome boy, he's 30 years old. Now, whenever I use this, he's so restless, doctor. He doesn't want, he said, like, he's so like restless, So What can I do about it? I still want to use it on him. Why does he
Okay.
find it so restless, when I put it on his wrist and the nasal,
He's restless after using it, or he's
during that time,
restless in general, and then it's hard to use it.
Yeah, you see, I put it on, it'll be all right, 5-10 minutes. Then it started
Okay.
to, fidgeting, and he wasn't too like kind of fearful already when I want to say, okay, let's do the IM laser. Then you say,
Sure.
he doesn't like it. He doesn't like it. But I want to use it because I see the benefits on myself. So I want to use it on him. Can you suggest anything else for him?
Does he, how is his sleep generally? Does he sleep well?
Sleep is okay. It's good. I mean, sleep is all
Sleep.
right. Yeah,
Sleep is good, okay.
Yeah, sleep is all right. And he's 30 years old.
Okay.
But I know that I can
Maybe
see
start off with the lower strength. Try first with 1 bar for 10 minutes, and then you don't have to build up too quickly, because some people are a bit more sensitive to the treatment compared to other people. So maybe he might feel that there are some changes that he's going through, and that made him feel like sensitive towards the laser. So maybe start off first with 1 bar for 10 minutes, and then do alternate day, and then give him fluids to drink, like water and all that. Give him fluids to drink,
definitely. Yeah,
and
I'll
then
do that.
slowly step up gradually. Like if you notice that there's a resistance or restlessness, then step down again, and then just do it very gradually.
Gradually
You can
would
do
be
it just
like
with if you find it like difficult to, if he's removing the nasal line, then you just do the just on the wrist will be fine.
Is there any, but is the potency, I mean, is it the same benefit you get it from that? Do you get the same benefit?
You will get a reduced benefit by using it just on the wrist. It won't be as beneficial as using it on the wrist combined with the nasal line, but at least it's a start, and you get him to use it. Sometimes some people, if their general health, if you feel that there's they don't have diabetes or high cholesterol, hypertension, they don't have visible parameters that we can test, you may be able to see changes on a microscopic level, on a cellular level. So it is going to be beneficial for him to use it. But if you notice that he's able to cope with it, then just give it to him at a lower intensity.
Which means if I use just on the wrist without the nasal, I start
nasal line. Yeah, start off with that.
Without the nasal line,
yes.
I use 1 bar, is it? The intensity
1 bar for 10 minutes.
For 10 minutes.
And then just observe. Then give him a break, rest, maybe a day break in between, and then alternate day therapy.
Okay. But what is? Sorry, doctor, I didn't hear that. Why is he feeling like that? Is any particular reason?
He just may be more. I'm not sure if you feel that he's more restless after using the device.
During the time.
During the time, okay. He just
he may happy. Once it's done, it's very okay. It's really, he doesn't complain, nothing, But I see that if I use for half an hour, there is a bit of difference in him. But during the time, like I have to pacify him, be with him, So I find it a bit stressful myself when I want to do it and I cannot do it. You see, so I need. That's why
he might be just a bit more sensitive to the laser, and maybe there's some microscopic changes that are happening that he's sensitive to, and then it's making him feel a bit more excited, and then he projects it in a sense of being restless.
Oh, okay. So I start.
But it's not going to cause him any harm. It's just that period. Maybe you can do it in the earlier part of the day, and if you feel that he's more energetic, then you start it off at the earlier part of the day.
Right.
But for it may be able to help in terms of sleep and energy and general health as well.
Yeah. So if I just use it, I mean, without the nasal lines, I would see the difference in a matter of time.
You would see some. There are some patients with quite serious conditions, health conditions like impending kidney failure, who've not used the nasal line. They've only used the wrist line, and they've managed to get good effects.
Okay, great.
Yeah, because there's also the acupuncture benefit and the magnet benefit as well.
So slowly I can, if it's comfortable, then I will, switch to the nasal line. Yeah.
Yeah.
Yeah. Okay. All right. Thank you so much. Understand.
Okay, thank you, Vijay. Maybe you can try to do it during sleep time or rest time. What do you think? There is someone recommended this type of treatment also. What do you think? If let's say sleep time, you just wear it on the wrist. Maybe you can try on that. Okay. So next question. Okay. Josephine Tan is asking, my friend has a pacemaker for more than 30 years. Can he use IM laser once a day from only 30 minutes on general health? Okay. Basis is okay, but not
it's safe. It doesn't interact with pacemakers, so it's safe to proceed to use it, both the wrist and the nasal line. They can use it even 30 minutes twice a day. It's fine.
Okay, thank you, doctor. Okay, Rama, hang on. Let me finish up all the question first. Yeah, okay. Because there's they are queuing for that. Then Mano, okay, can IM laser help to trace a athlete who has a rectus femoris for 2 years now?
Okay.
Can you read the question, doctor? Can you see the question from the chat? Rectus femoris for 2 years now. Okay, so can you see the question, doctor? Okay. Oh, doctor line is actually okay. Okay now.
Okay. Yes, what they can do is they can apply it to the affected area, and do targeted therapy. That would be quite beneficial. 30 minutes, start off with 10 minutes, then 20 minutes, then 30 minutes targeted therapy. And then they can even go up to 40 minutes, 4-bar, frequently 2 or 3 times a day, along with the use of the wrist and the nasal line. So it should be able to help. It helps by reducing the inflammation, the damage to the area. It can also help by reducing the pain, by affecting the pain fibers, and also in regeneration of the cartilage and the ligaments. It can also help to regenerate that. So it will take time, but it has to be used consistently with sufficient amount of rest. And I would recommend maybe to use some ice application after that, after the treatment, after using the laser, to use some ice application, maybe an ice pack, just to soothe the muscles after that.
Okay, thank you. Thank you. Next question. Okay, next question. Oh, from Anita. Hi, doctor. I have a friend who have a hormone imbalance. Has changed her lifestyle, increase of weight. Can IM laser help, and also CVA?
Yeah, actually, it's a good option for her to consider using both IM laser as well as CVA in tandem. So hormonal imbalances can be quite complex sometimes, have to go into a little bit of blood taking, maybe see an anti-aging doctor and do a profile of hormonal tests. And sometimes they have a use of certain hormones which are called bioidentical hormones, which come in the form of pills or creams that can also help to speed up the recovery process. And also lifestyle changes, like choosing a lot of health-based foods. Sometimes the stress can be one of the contributing factors for hormonal imbalance. So there's a change in the cortisol levels, and that can impact the weight. So focusing on managing the stress, like yoga, meditation, deep breathing, and also in tandem using the laser can also help to improve the metabolism and also stabilize the hormones. Hormones are quite complex. They're something like baking a cake. you have to get the right recipe. If you put too many ingredients, it will go bad. If you put too little ingredients, also won't taste good. So you have to get the right mix. So laser photobiomodulation has immunomodulatory benefits, where it helps to adjust the immune system. If it's too active, it will calm it down. And if it's inactive, it will speed it up a little bit. And CV8 also has this adaptogenic benefit, where it helps to stabilize the immune system.
Thank you, doctor. And I hope, Anita, you get the answer. In fact, we have a lot of our customer with hormone imbalance after using IM laser in actual fact, it helped a lot to improve the health. Okay, so next question from James. Can the current vaccine help to fight against COVID-19 virus? If yes, why do we need to go for a third dose or so? Maybe need to have a vaccination every year.
Yeah, the vaccine does help, but what they found out was that the antibodies produced by the vaccine, we produce antibodies in two ways. One way is we get antibodies when we take a vaccine. Our body starts producing antibodies towards the protein that is so-called a fake virus introduced into our body. And then we start producing antibodies towards that. So if you do an antibody test, for example, you will know that you have some antibody level to fight against COVID. But this tends to wax and wane after, on average, a period of about 5 to 6, 7 months, probably. So somebody, say, for example, taken the vaccination in March, by the time they reach October, their antibody levels have started to decline. And that may impede the need to use a third dose. It may get a little bit taxing for us that we have to every now and then go for vaccination, but with the situation with COVID, we have to kind of play it by ear, because last year we were hoping that this year everything will be cleared off, and it's still around. So we have to kind of make amends to what is practical, and do what is necessary to keep our antibody levels up, and at the same time practice proper SOP.
Thank you. Thank you, doctor. Okay, next question. Okay, from Josephine Tan. Will IM laser help autism and also ADHD?
There are some pretty good testimonies of people who have used it for autism and ADHD. I do recommend to use the laser device starting slow, because sometimes with autism and ADHD, sometimes they do get a little bit more energetic initially, and then they tend to calm down after. So it's always better to start off slow and slowly build up. And some of the benefits that they have noted is the patients are more calmer, they sleep better, they're easier to follow commands, and there's some improvement in their functionality as well. Also quite beneficial is vitamin D and fish oil for autism and ADHD. You can also use these supplements in tandem with the laser device.
Okay, thank you, doctor. Hope you get the answer. Okay, next question will be from Lim Kit Jin. Does IM laser nullify the antibody generated by the vaccine? Okay, inoculated into our body.
No, it doesn't. It doesn't impact the vaccine to reduce the number of antibodies in our body to the vaccine. So it doesn't have a role in reducing or have us having lesser antibodies.
Okay, so understand, Lim. Okay, next question from Johnny. We have a light therapy for the neck 1 point. We've used for 361 acupuncture point. A medical officer did ask how to explain how the impulse can be detected to every of the 361 body and meridian point at the same time.
So these pathways or acupuncture points are anywhere between 361 to about, even some say up to 2,000 points in our body. But when we are using the laser therapy, this combination is very interesting. It's actually the first to do laser as well as acupuncture combination together. And this actually helps to speed up the acupuncture effect by up to 50 times of that of traditional acupuncture. Also, the penetration power, there are 5 milliwatt lights, 5 of them, and that equivalents to 25 milliwatts, and they're in a divergent beam that penetrates in a depth of somewhere around 1.5 inches into our body. And that through the PC6 or the P6 point, the Nguyen point, it will project to the gateway, which is the heart, and then from there it will penetrate throughout the body. So the projection is throughout the whole body, and that's how it helps to target everywhere. It may not be all at the same time, but it takes its course.
Okay. Thank you, doctor. Okay, next question from Anita again. Doctor, can IM laser therapy recommended for Parkinson? Okay, I would like to answer this for this one, add on to this. Parkinson, in fact, we have been helping quite a lot of Parkinson patients. Okay, so again, it depends on the condition also. Some you will see the improvement very fast. Of course, some will take some time. Okay, doctor, maybe you explain a little bit.
Yeah, for those who are using it for Parkinson's, they will have to, because it's a degenerative condition of the brain, they're going to have to use it with the nasal line to get the maximum benefit, and use it frequently. They'd have to use it frequently, at least 2 or 3 times a day, to derive consistent benefits with it. And probably they will see motor function, sensory function benefits, like the person having a better coordination of their limbs. There are some Parkinson patients who have difficulty walking, have some improvement in their limb function after using photobiomodulation therapy. And also in terms of their functionality, putting on clothes, walking, eating.
Okay. Thank you, doctor. Okay, next question. Adeline, good evening, doctor. Can IM laser be used for a person who has PDA, cardiopulmonary surgery since young? ECG, CT scan has done in a 2019. Doctor comment everything okay, but lately this August he felt fast heartbeat, especially when she had an intensive exercise. Still sometimes she couldn't sleep. It is safe for her to use IM laser? Is it safe? I believe the answer is yes.
PDA is a congenital heart defect, patent ductus arteriosus. So they can use the laser device safely, both the nasal line and on the wrist. Use it regularly, at least 30 minutes twice a day, and they may be able to derive some benefits in their sleep, as well as in their ability to exercise.
Okay. Okay, next question. Okay, Vincent Kong comment. Okay, good. Hannah, regular use of IM laser could improve our body immune system. It's true. Okay, especially we have come across of those COVID patients. Okay, after use it, you can see the improvement. Okay, the recovery is very fast. Please use it. Okay, Brian, you got 2 questions. Rest of question. Okay, Anita say thank you. Dennis say, can IM laser help for those having neck slip disc?
Yeah,
Neck slip disc.
we have testimonials of patients who have slip disc on their neck, on their lumbar region, the lower spine, and targeted therapy will be beneficial. So they'll have to apply it at the neck area, at least 20 to 30 minutes consistently, at least once to twice a day. They can use the strap also, and apply targeted therapy to the neck, and also use the nasal line. And it should be able to help to both reduce the inflammation involved, as well as reduce the pain. But in slip disc, sometimes they also have to see a physiotherapist and also go for some rehabilitation exercises, as well as some traction. And they can do combination therapy, going for rehabilitation, as well as using the laser. There are some studies where patients who have consumed painkillers for a slip disc of the neck, they have found out that using photobiomodulation actually helps them to reduce the painkillers, and also some of them can go off the painkillers completely.
Okay, thank you, doctor. Okay, next question from Brian. Brian would like to talk. Is it? I unmute you. Hang on. Okay, Brian?
Good evening, doctor. I have two questions. Can you hear me?
Yeah, I can hear you.
Yes.
Okay. I have a prospect which is she's actually 91 years old, and recently, couple of months, she had a fall. So she was actually doesn't have any energy level at all, and she's actually on those soft food like the oats or porridge lah. And her consumption of food is actually has to be very small, and most of the time she will actually choke when she consumes even mild hot water lah. Then the situation is at this her age, she's and I think she's actually bedridden now, and she's actually having difficulty moving around lah, and there is actually a maid taking care of her. And what is your advice on her usage at this juncture? And what is the bar that is recommended for this kind of situation? Okay, the second question is talking about gallstone, calcified gallstone in the gallbladder, which is around 1.5 cm. What is your advice on protocol on IM laser regarding this matter? Thank you, sir.
So regarding the 91-year-old lady, what she can do is she can use it on a few targeted areas. There's the Higuan point, which is below the navel. So about 1.5 cm below the navel, she can use targeted therapy there. Start off with 1 bar, 10 minutes, then slowly increase 2 bar, 20 minutes, until she can go to 3 bar, 30 minutes, twice a day. And also, second targeted point for energy will be the Chu San Li point, which is on the knee, roughly about 1 centimeter or 2 finger breadths below the knee on the outer part. So the light will be on the outer part of the knee, just below the knee area. So these are the 2 points that she can use for fatigue and tiredness. She can also use the nasal line. If it's possible, do targeted therapy on the navel, on the knee, maybe 2 sessions a day, and then 2 sessions of the nasal line as well. So about 4 to 5 sessions a day to increase her energy, but do it very gradually. Start off once a day and then slowly step up to twice a day, and then see how her improvement is.
Okay, Brian. Okay,
So
did doctor answer the question? Yeah.
That's the first question, and the
Okay.
second question
question,
is for gallbladder. Gallbladder is a little bit complex because sometimes if the stones are very big, the only modality of treatment will be surgery. They have to go for a surgery called cholecystectomy surgery, which can either be laparoscopic or open surgery. So there are few modalities that they can do. They can use the laser device and see if it helps to emulsify the stones, because the gallstones can consist of different, they can be calcium stones, they can be uric acid stones, they can be oxalate stones. So depending on which, sometimes they may respond, sometimes they may not respond. But you can get some recipes of natural methods to clear out the stone from the internet. There's one recipe which is about 4 to 5 apples a day for 5 days, followed by Epsom salt at 6 o'clock and one glass of water. Epsom salt at 8 o'clock, another glass of water, followed by olive oil, half a cup on the 6th day. So on the 7th day, patient may notice gallbladder stones to be cleared out. So IM laser alongside with these herbal options may be a better option.
Okay, doctor, just to double confirm, instead of using Epsom salt, because Epsom salt will actually scars the tissues of our intestine, right? So instead of using
diluted,
Epsom,
it's just 1 teaspoon, yeah, diluted. So it's quite harmless. Epsom salt used to be used as a laxative quite some time back on a regular basis, but then now they use it more on external. It's basically just magnesium sulfate.
Yeah, so there's another option is using magnesium oxide. Is it advisable?
Should be fine. You can try out different variations to see which one works. This is the one that I've come across. It does produce some pretty good results.
Okay, Brian, you can answer. Okay, now we go to next from Lily. I have a customer who just bought the IM laser. She has tinnitus and tinnitus. She said she felt giddy and also want to stop using for time being. What's your advice?
Tinnitus, there are different causes of tinnitus. So it can be metabolic changes. It can be something to do with the ear imbalance. Sometimes it can be due to the brain. So she'll need to diagnose what the cause of tinnitus is. There are some patients who have used the nasal line directly in the ear where it's pertaining to ear causes and they found improvements. But if the tinnitus is caused by something else, then she will need to investigate, like maybe check her sugar levels, check her blood pressure levels, and see if that is the cause of her feeling giddy, or whether she has something called Meniere's disease. Meniere's disease is a combination of hearing loss, tinnitus, and giddiness. And that may be beneficial using the photobiomodulation with the nasal line, but maybe start slow.
Okay, Lily, hope you got it. Okay, next question from Mona. Can it help someone with a severe stomach ulcer?
There are patients who have used it for stomach ulcer. They use targeted therapy where they apply it directly to the abdomen area, and they have got improvements by helping to reduce their stomach acidity. They can use it alongside with PPIs or proton pump inhibitors, maybe for a period of about 2 to 4 weeks. Something like Controlog or Vencid, pantoprazole. So combination therapy using the laser device along with the proton pump inhibitors might give them faster results if they're having a lot of pain.
Okay, so Mona, hope you got it. Okay, Lily, how often? Okay, just now doctor answered already. And Lily also asked insert insight into the yes, you can. Okay, next question from Connie. Any testimony on eyesight improvement?
There are some testimonies of people who have glaucoma and early stages cataract to find some improvement. Late stage cataract, they have to go for a surgery. But early stage cataract and as well as glaucoma, there are some testimonials of patients who have used it and got good results.
Okay, thank you, doctor. Most important, if let's say you all want to have to improve the eyesight, you need to put on the nasal line. Okay, nasal line is actually to help to improve our eyesight, the whole head problem. Okay, whole head problem, including your brain, your eye, your nose, okay, and also your face muscle, all these things. Okay. Okay, any more question? Okay, last from the floor is actually Rama. Just now Rama, is it? Rama, it's your turn right now. Okay, Rama, are you still there? Okay, no, maybe he's not around already. Okay, any more question? Wait, okay, fine. Rama, okay, come, I'm you.
Can you hear me? Yes.
Yeah.
Schizophrenia, is it? That's a psychiatric problem. Can this help? Can our device help?
Yes, the device can help in a lot of mental health issues, including schizophrenia. The patient will need to use it on the nasal line as well. Of course, it's still the nasal line will be the one that will be beneficial for them. And if the patient has any sleeping difficulties also, it can help. And it will be in concomitant with treatment with the psychiatrist, if necessary, taking antipsychotics to benefit them, and also hand in hand.
I see. Does it also help for? Does it help also for this? What do you call this? What do you call this? We have this.
Depression?
No, one more thing. You know, one more reading. Hypo and hyper.
Bipolar?
No. Hypo and hyper. What do you call that? Is hyper.
ADHD?
You know, hyper also causes the problem with those people with this. You know, hyper what this something to do with your Adam's apple. Hypo.
Thyroid, is it?
Thyroid. Yes, thyroid. Yeah.
Okay, yes. Definitely can help for thyroid. So there are some patients who have used it for hyperthyroid problems and hyperthyroid problems as well. And it helps to regulate and stabilize the hormones. However, it's not recommended to use directly targeted therapy in front of the neck. So nasal line along with use on the wrist, stabilize the hormones, but may need to follow up with the doctor for their blood test results to see the improvement and take medication alongside.
Just now when you showed the results of our 3-4 patients who used this and the triglycerides, etc., came down, is it CV8 with CV8 alone or with our Vantros?
CV8 alone. That was just
alone.
CV8 alone. Yeah.
CV8 alone. I see. Okay, then the other one is this number of times you're supposed to do is the longer is better, or is there a kind of a tapering off point?
Ideally, it's 30 minutes, twice a day, 3 bars is what is ideal nasal line along with the wrist in tandem. That's the standard treatment for maintenance. But if a person has any specific health issue, then they can increase targeted therapy to a specific area. I think Jaslyn has the slides on the acupuncture points where, if, for example, migraine, which area to use it for, and there are specific areas to use it if they want targeted therapy, or they can apply it directly to that area, for example, if it's giving them pain or discomfort.
I see. Is there any way we can call you if really necessary?
I think you can contact the company, like you can contact through Jaslyn.
I see. Sorry, contact to?
You can contact the company directly.
I see. And then from there, can get back to you. I see.
Yeah. Any question y'all can post to Andrew. Okay, Andrew will refer back to doctor. Else, if let's say we got a lot of all the customer want to contact, I think just answer the question. You'll be very busy already. Okay. So maybe some of the leader might help out also. Okay, unless maybe certain very critical or maybe very specific question that we can answer, we'll refer to doctor. No, don't worry, we'll get an answer for you. Okay, Rama. Okay, thank you. Sure. Yeah, last question from Phoebe. Can IM Laser help someone who used to hear his heartbeat in his left ear? Oh, his heartbeat in his left ear. Wow. Okay, so what kind of problem, doctor? Hear his own heartbeat.
I think there's no harm in trying. If the person is still having this problem where it's basically transmitted sound to the left ear, and they might benefit from some form of hearing aid, which can introduce some amount of static to cancel off the sound, or they can consider to try out the laser device, or even to use targeted therapy inside the ear in itself.
Lily, Phoebe, got it, okay, try on that, okay, go ahead and try on that. Okay, no more question from the floor. Okay, I think that's all for tonight's talk, and I hope that everyone benefited from today's talk and also learned a lot, okay, from this new term, photobiomodulation. No? So once again, thank you, doctor, and also thank you everyone for attending our talk. Yeah, thank you so much. And we hope that we are able to get another session from doctor, because actually his schedule is quite tight. So next time we hope that we are able to hit 1 terabyte. Okay, so thank you everyone, and good night and stay safe. Thank you.
Okay, good night everyone. Take care.
Yeah, y'all can maybe on your video, or maybe your unmute yourself to say thank you to doctor. Okay. Yeah, just unmute all. Then, or maybe they will.
Thank you.
Okay.
Thank you, doctor.
Thank
Thank you,
you.
Doc. Thank you very much.
Thank you,
Thank you.
doctor.
Very
Thank you, doctor.
clear. Thank you, Jesslyn.
Bye-bye.
Bye-bye.
Thank you,
Okay.
Jaslyn.
Thank you very much, everyone.
Thanks. Okay. Good night.
Thank you,
Jesslyn.
Dr. Ashwin. Doctor,
Good night. Good
thank
night.
you, Jesselyn.
Thank
Very,
you.
very
Thank
nice
you.
helpful.
Thank you.
Yes. Thank you.
Okay.
Bye. Good night.
Bye. Good night. Okay. Thank you.
Bye. Good night.
Okay. Thank you.